tuned in again to another version of the Journey 2020. We like to say the journey is from you to me and me to you. And in journeying to you tonight, I want to firstly introduce myself. I'm Dr. John Robertson, clinical psychologist here in Orlando, and I might as well say Hotlando because, and this is not to talk about you folks in the north, but we're sporting about 90 degrees midday here today. And I want to say that I'm glad that I'm here rather than anywhere else, even though it's hot. And with that, I'd like to introduce my co-host, and my intrepid co-host at that, Charles Morse. Charles,
Okay.
how you doing tonight?
I am truly blessed, Dr. Robinson. I'm happy to be here. I'm happy to be here in the South. Happy to be part of that 90-degree weather. It was funny because the last time we had this conversation, I was saying that there's a good chance that the cool weather was behind us. And I think I told a fib because it's actually, not cold like up north, but for here in this late in part of April, the temperatures did drop a little bit, for the Floridians,
Right,
because if it drops anywhere below 60, they below 60, people here lose their minds. So the temperature did drop, but it's back up where we would be like, oh, it's beach time, fishing time, blah 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 blah. So not complaining about the weather, but April is drug
Is Alcohol Awareness, National
Month.
Alcohol Awareness Month.
Okay. In addition to the sexual abuse month as well, right? Right.
Exactly.
So
And I also found out
right.
that it is also National Minority Health Month.
Okay.
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 So we have the three topic areas that affect our community mightily, this month. And so with that, tonight, I'm glad that we have the guests that we do have on.
Okay.
But
Well,
Charles, you were starting to say something.
now when you said that, and we always go into a show. But I would like to do a show, and I know that there's a few people in this area that could go back to the history of when the drugs started to affect us, as far as the neighborhoods, and also the laws, and how it affect us as far as how the laws was written, and then how it affect us going to prison based on how the laws was written, knowing what was in our neighborhoods, and the overall effect and how it has affected us as a society, as people of color, our family as a whole. That would be,
Well,
but I'm
I
saying
think-
when you really think about it, how that really affects us, because it always goes back to dollars. That's what drives us in
Yes.
in this country.
Yep.
And it goes back to dollars because as people, because sometimes I'm in meetings, and I'm jumping ahead, but sometimes I'm in meetings with people that that are talking about trying to, going through the prevention, and they're talking about trying to help, but sometimes they don't understand what's really going on from higher up,
Yeah, absolutely.
and I am responsible for myself, but there's another side of that
Right.
pushes things because of our culture and where we live and how we live and what we I would say cherish as far as what we feel is important, and that's another show.
Yeah. Well, actually, I'm going to say that I think that sits right at the center of what we I'm going to say what we should be talking about tonight, and that is that while alcohol itself is legal,
Right.
but if you think about just what you said, and I absolutely agree with the direction that you were going in, that there is a politics that is involved,
Right.
there is an economics that is involved, and I'll mention a little further into the show a little tidbit that ties in also racism.
Well,
Okay,
that's what I meant by our
that's
neighborhoods.
exactly.
I mean, in our neighborhood,
Yeah.
but also when you try to, because I've had conversation with people, and to try to get them to understand what drives the prisons. It has nothing to do with rehabilitation.
Oh,
Okay,
by no
you know,
means.
that's the last thing the prison wants. Like,
Right.
no, we want repeat offenders because that's how we make our money.
That's business. Yeah.
Right.
Yeah.
So that's business. So I don't need you to go out and be, some successful person in society. No, I need you trifling.
Right.
And
Right.
that's, not everybody, but the reality of it is that's what drives a lot of prisons, especially when they're privately funded. Da, 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 So there is a poem that a friend of mine wrote that I'm going to let you hear, and it
Okay.
talks about that, and
Okay.
that's what I was talking about. Who's a gangster? Who's the true gangster? When it reflects on the fact that you can start a war. First of all, you can steal an election, then
Right.
start a war, and then your friends get the rebuilding contracts to go over there
Right.
and rebuild what the war, blew up.
Right. Exactly.
So it's like, who's the real gangster in the sense of you think small, but understanding when you
There's a larger picture
right.
to it.
So, but
And not to interrupt, but I think that that's why what we do on the Journey 2020 is so important, because we're not only talking about a specific phenomenon in our community, but how it fits into the larger picture, of the society.
Right.
And with that, I want to reintroduce a friend of ours, and that is Dr. Marcia Flagler. And some of you who are regular watchers of the Journey 2020 remember that Dr. Flagler was here, and this was back in February, if my memory serves me right, and who talked then about some aspects of drug treatment and recovery. Tonight, we're going to expand that topic, and as Charles started out, talk about how alcohol and other drugs, how does it affect us? Just how serious, the problem is, and then also what, if anything, we can do about it. And in starting out, Dr. Flagler, by the way, welcome to the Journey 2020.
Thank you.
Okay, yeah,
Glad
Charles.
to be here again.
That's it. Charles and I start talking, and the
But it
show
was
goes
interesting.
on.
I was
Okay.
enjoying it.
and actually,
Yeah.
I do want to go back to, tell you that I want to make a comment. And part of, sometimes in the meetings when I'm with some of the people and they're talking about the prevention, and then they talk about whether or not certain drugs or whatever should be, legal, or, and where I'm from and how I see it, I have never ever met anybody who had money and said, you know what, I can't find what I'm looking for. I've never seen anybody go, you know what, I got this money and I can't find the drugs I'm looking for. I have never run across that ever. I've never heard anybody make a complaint about it. I've never ran across it. So I don't get it, because who are we fooling? So if I want it, if I got the money, I can get it.
Yeah.
So
Right. That's right.
what? I don't get it. So when you go, should it be legal? If I got the money, I can go get it.
Okay.
I've never heard anybody go, well, today I just couldn't buy my drugs. And then the other part of it too is, I think it has more to do with who we are, because you find out no matter what it is, people find more ways to get high.
Right. Yeah.
So I don't think it's a matter of whether or not you should legalize it. I think we have to find out what is it that we have within us that make us feel that we need this in order to be who we are, in order to be happy, in order to just make it through the day, because I think that's the problem. Because who is it that can't get drugs when they want it if they have the money?
Right.
And I never heard anybody really address that.
Oh, okay.
So,
Well, let's address it tonight.
not, I mean, but I'm saying, I mean, I don't know your background. I don't know. I'm talking about both of you.
I hear you.
Okay. Have any of your friends said, man, I just can't find any drugs and I got money?
Right. Well, Charles, as you know, anything in the society that you want, be it drugs, be it, and I'll just keep it real, be it a woman, be it a gun, be it whatever, that, as you rightly said at the beginning, that money drives, so much of what we do and what we say in the community. Now,
Money talks.
Absolutely.
Always.
And
Yeah.
our
So,
Supreme
yeah.
Court,
Yeah.
has recently said that money they've actually equated it to speech, and so that the old what do you call it? Proverb about money talking is really gotten validated by that. But coming back to Charles's point, that one of the things that money has done is that in those communities like ours that don't have it, be it drugs, be it anything that you can think negative, that for the need of and at times the want of money, that often the access to those drugs will lie in our community. Now, the problem with it, and I'm following where you're going with it, that without some kind of a regulation, okay, and this is my point of view, that our community, as in the 80s with crack, okay, would have become, as it did back then in the 80s, overrun with, with drugs, and we're still dealing with some of the aftermath of the ripple of that being that specifically crack being purposely introduced into our community. Now, I know a lot of folks would say, well, your folks, they didn't have to use it. That they could just, again, if they wanted it, why not let them have it? Okay? The difficulty that I have with that thinking is that it allows those communities like ours that don't have the protections around it, as in legitimate police protection, that also, Charles, the kind of services that we need, so that we don't have to rely on the gray market or the black market to get the things that we need. And then also, coming back to your point, that, and also in our community, because we have been told and convinced that that we are deficient, okay, that not only monetarily deficient, but that we are intellectually deficient. Okay, we've been told that we are socially deficient. We have been told that we can't have healthy relationships, with each other. So again, considering that, if somebody is always telling me that I'm deficient in one way or the other, and something is going to make me feel good for even a few moments, okay? Now, am I going to say, well, no, I'm not going to do it, okay? I'm going to stay in my, and I'm going to exaggerate here, I'm going to stay in my pain. Okay? I'm going to stay feeling lousy. I'm going to stay feeling deficient, etc. Of course not. I'm going to say, listen, you got something that's going to make me feel
Make
good?
sugar.
Okay. Sister, listen, what you got? I
Yeah,
want
yeah,
it. Okay?
Okay.
The problem for us, and again, for the larger community too, but particularly because we're more vulnerable, because of some of the things that I just said, that we are, interestingly, and this is something I would say is part of the science. Our use of drugs across the board, in most instances, is not any higher than the white community, but the consequences
But
of that use
but
is much more severe.
right, but also that's when I was talking about going back to the laws, our laws that affects us. Oh, that's what I meant by that. But you also touched on a couple of the things that I said, which was the legalization, whether it's legal or illegal, has nothing to do with the mindset of why they use it. Okay, so again, that's when I was talking about our mindset, and we're trying to numb the pain of trying to say, okay, who are we that we feel we have to do this for this reason? Okay, and that's why I was saying, which has nothing to do with the legalization of it, because the whole point of it is, whether it's legal or illegal, this is where I want to go to numb the pain, because as long as drugs been out, it's been illegal.
Well,
But
I'll partially support your point, but I do think it has something to do with
With
use. Because let me give you an example. Now, would you say to a 12-year-old, okay, you want to use crack, okay, you want to use alcohol, okay, go ahead and use. There are some laws that are put into place, okay, that are designed, and I'm not saying all laws are good, all right, but I'm saying that they form a framework in which we can respond to something or not. Now, how we apply those laws can be either fair or extremely unfair. But for many of our young people, the fact that there is a law against them using alcohol before the age of, what is it, 18, et cetera, okay? Now, it's not a fail-safe. And there are some kids who are going to say, oh, the law, I'm 14, I'm going to check this out. But for many youngsters, and for many of the parents, it allows them for that youngster to say, you are not ready, for, alcohol or drug use yet. Wait until you get to, that legal age. Now, what our legal system has done in many ways is perverted the guidelines so that it becomes not only punitive, but it is disproportionately punitive to our African American communities. And that's what I find wrong. But what I want to do is to let my colleague get in here for a little bit, because again, she's dealt with so many of the populations that we're talking about, and I'd really like to pull on that real life experience and to see what your thought is, and perhaps in response to what we've just been talking about.
Well, interestingly enough, when we talk about underage drinking, one of the things that has been real alarming is to find out that for underage drinkers that drink and binge, they actually consume more alcohol than the adults. So what we find is that there is a lot of underage alcohol poisoning going on. We've got a lot of families that are coming to realize that out of all drugs, alcohol is causing more deaths for your underage drug abusers. And a lot of times people say, well, alcohol isn't a drug, but however, alcohol is a drug. It is a drug. But then what happens is that because it's legalized, there tends to be so many other challenges that come about. But particularly, what I find is a lot of us are not aware that we find out underage drinkers, they can drink adults under the table. And particularly when we look at college students, where we have a lot of prevalence and rise of all drugs.
Okay.
But one thing that over time and over just years of not just experience in the field, but even my own experiences in college and being an athlete and professional athlete, all of that, there tended to be these things. Smoking pot wasn't no big thing, so we thought. Now one of the studies has shown that for those youth that begin smoking pot at an age of 12, they are a high risk for mental health diagnosis such as schizophrenia.
Really?
And that there have been studies that are showing there's a direct correlation to the earliness of their first starting to smoke marijuana. So statistics like that is what is being, highly pushed. So for awareness, now that we find that marijuana is about to become legalized for medical purposes, which we know, I mean, if we have youth taking grandma's medication out the cabinet, we know that they're gonna definitely get the marijuana out. They're gonna get the stash.
Okay.
But one of the challenges is meeting that population where they are, who feels invincible. Because at that age, I thought I was invincible, and I was an athlete too, and was kicking butt and taking names. Oh yes, I was invincible. Okay. That was the mindset. And even thinking that it would contribute to other drug use was just, didn't believe it. And now, does it do that for everybody? No. Everyone that may have drank early on, underage drinkers, everyone that has smoked marijuana early, or that have used any drugs, doesn't necessarily end up with a chemical dependency and being addicted. However, it doesn't take but one use to end up with a DUI, driving under the influence, to be impaired and kill someone, which is what we find with a lot of underage drinkers. There aren't as many dying of direct alcohol poisoning, but they're dying from different behaviors that are a result of being under the influence. With that, are definitely associated, and we're seeing it even more so. We see it tremendously in the news. So, and I think that the awareness in our communities is important, because yes, they have targeted us, and we're those of us that are minorities, we definitely suffer the most. Even, and it's on and everything. I mean, unfortunately, when you mention the racism, it is still alive and well, unfortunately. And we can look at it in regards to the alcohol and the criminogenic behaviors and so forth, and who gets what charge, but it is about money. Who has the best lawyer when you walk into court? The same exact charge, but who's got the money a lot of times? It's who's going to end up, because they have a well-paid lawyer who's able to go in and, present things that the public defender isn't even going to take the time out to look for. So I think ultimately it does kind of regenerate a lot of the suppressiveness of our communities, because we're impacted. Our minorities are always kind of getting the back end of the stick somehow.
Just about everything.
About everything.
Exactly.
But but that means that what we have to do, though, as a community and as families, is to build ourselves up more, because a lot of the low self-esteem and toxic shame, a lot of those issues are starting way before the addict and alcoholic ever picks up. That teenager that, instead of coming home and say, my buddies, they out drinking and they smoking pot, I feel like drinking and smoking pot too, and they worried about getting their head knocked off, instead of having being able to communicate and not being made to be feeling ashamed, but having that communication, because it's Nowadays, it's just so much. It's way more than it was even
Back in the
when I
day,
was younger.
yeah,
Yeah.
exactly.
You know, and back then, I just was kind of curious more than anything. But I knew better. It wasn't like
Right.
my family didn't raise me better.
Right.
But,
right.
you know, I was like,
Right.
looks like they feeling all right.
Right.
Let me check it out,
Exactly.
you know.
And
You
I
know?
think that's an important point because often, we'll see, even with some knowledge, we'll see peers, and like you said, it looks like they're having a good time, look like they're having fun, and with a lot of our young people don't want to be quote unquote squares or left out, etc.
Right.
And again, get caught up in that.
Right.
One of
right.
the things I wanted to share, and I was looking to update some of my information about just how lethal the impact of alcohol is, and I just want to share this, and this might underline some of what we're talking about, and that is that the latest stats are that something like 17 million people, or every one of every 12 adults suffers from alcohol abuse or dependence. And and think about it. Most of us know either a family member, a good friend, a colleague, and across probably any and every profession. And as Charles was saying a little earlier, that and I'm talking about alcohol now, that with physicians, pilots, cab drivers, whatever, that are nurses, etc., that are affected by this and often go untreated. Partly because of the mythology that alcohol is legal.
Yeah.
Okay.
Yeah.
So if it's legal, then it must be okay. There's nothing wrong. But here it is. You have almost 80,000 people a year dying, from the effects of alcohol.
Right.
Now we don't put people in jail, for using alcohol. But the interesting thing is that we do have laws that say, not only
Don't drive,
age
don't drink
limited,
and drive.
right? Drinking and driving. And one of the interesting things is that after the implementing of the drinking and driving laws, that the rates of death from DWIs has consistently dropped, over the last, I think it's something like 10 to 14 years. And I used to follow the stats, year to year, and I've kind of gotten out of it. But with the DWI laws, which many people thought, well, what is that going to do? But it, on a real basis, has seemed to have lowered the rates, of death from DWI. Now you get a lot of people complaining to say, the fines have gone up, the all of the hoops that they have had to jump through have gone up. But if we can save lives, then my question is, isn't it worthwhile?
Yeah.
Okay.
It is.
And so earlier on, I had said that I partially agreed with Charles's point, and that is that instead of incarcerating drug users for that, then why don't we? And I'm asking a rhetorical question, but I'm going to ask you to respond to it anyway.
Okay. Okay.
Why don't we simply, for those people who do get into trouble with crack cocaine or powder cocaine or with other drugs, why don't we do what we would do for other diseases or other problems, and that is provide effective treatment? And I would ask you, why is that we'd rather incarcerate folks, and as Charles rightly said, that creates a money stream. But why do we continue? And we seem to starve the whole treatment aspect of it. Okay.
Well, one thing is funding, because there was, I guess, maybe a good between 15, 20 years ago, even here in Orange County, there were a number of programs, and there was a linkage of offenders that they would start with treatment early in my career. I had an opportunity to be a part of, it was corrections chemical dependency program. It was a full modified treatment community in the jail.
In the jail?
In the jail.
Okay.
And what we did is we went in first thing in the morning at 8 o'clock. We brought the population that was in that group would come in, and they were there until lunchtime. They went back to lunch, came back in the afternoon and had groups in the afternoon. In the evening, had 12-step meetings. There was a peer level of support within, which is a part of the modified treatment component. And they had assignments, and they had independent. They got up and had meditation in the morning, came to group, went to lunch, came back to groups, went to meetings. Everything that happens outside happened inside. And from there, we were connected to a lot of programs on the outside. There were a number of levels of transition programs. At that time, there was halfway house, three-quarter houses. There is Sandy Payne, God rest her soul. She had properties that you would go from phases. You would go from these 2 big story houses with the men in one, the women in the other. You sharing bedrooms, and then if you stayed, graduated from there, and maintained their abstinence, followed their treatment plan, they moved into a community that she had duplexes, that there were 2-bedroom apartment duplexes. They phased up. It was a full, because diseases of addiction is progressive. It's developmental. It goes through stages. The same thing with recovery, but there was a lot of funding. The funding is not as prevalent as it was then. It's coming back, and there are a number of corrections efforts, because I work with different correction facilities, providing services, going in, whether it's voluntarily, whether it's staff-wise, whatever, because it is a very underserved population, and I have a passion for that population. And what I find is that the treatment components that are there and the linkages that we miss because of funding issues. We've got a lot of people are being channeled to drug court, and drug courts are doing a tremendous job. However, we've got another more severe population who are not getting their needs met for a number of different reasons. And then you've got doctors that I was at the American Drug Association, a conference, and they would talk. We had a presenter that came up, and he spoke about how when people go to the doctor, I go to my primary, well, not mine, my primary doctor knows my history. He knows I'm a recovering addict, but you find some individuals that go to a private doctor and they have all the symptoms that suggest that we need to give you a referral to go get a substance abuse assessment. They don't ever, and how many times do you see on the sheets, the assessment sheets, the medical assessment sheets, there's any room for being able to refer a person for substance abuse? If you don't tell a doctor, I'm in recovery, I want, I need you to know this when I have surgery, this, that, and the other. Particular person that comes in and says they're drinking every weekend, they fall and they break their leg. Why you break your leg? You break your leg because you were inebriated, and the doctor doesn't say you might want to. A lot of doctors aren't doing that. Some are, but the majority aren't. So we've got a lot that's, falling between the cracks, and it is a real high need.
Well, let me come back to something that Charles alluded to, and that is, and it may seem a harsh question, and that is that now with alcohol and with other drugs, nobody put a bottle, up to these folks'
right.
mouth and said,
That's right.
Okay, you got to drink this.
That's right.
Okay,
that's right.
And nobody put some powder up somebody's nose and said, okay, you got to snort this. Okay,
that's right.
And nobody. Well, I can't say that. We do know that in terms of sharing needles, at times folks will help each other shoot up, etc. But But again, in the larger part, nobody really forces anybody to to use drugs. So I've heard many of my friends say, "Well, you know, why treat them? I mean, they did it to themselves. So why spend good money, you know, for these folks? Because you know, just as they did it to themselves, then you know we ought to you know let them figure it out, you know, themselves. So what's your thought on that?
Well, I mean, your communities are safer with productive members of society. I would ask someone, well, how many of you would rather be in a community that your neighbors you know to be a recovering person, that you don't have to fear every time you see them pull in and out of their driveway, or watching everybody, because we know our community, we nosy, okay, so we know who pulling in and out.
Okay.
But I mean, it's about the safetiness, and it costs more. It costs more to incarcerate than it costs to help to get treatment. You know, so you're looking at cost effective. It costs taxpayers less for that same offender that has an addiction or has an alcoholism problem to get help than for them to continue to go in and out of the penal system. And then even when they're out, who are we harming? Who are we at risk of getting harmed? The neighbors, the other people in the community. One of the major things that happened to Tangelo Park some years ago.
That's a neighborhood in Orlando.
Yeah, that was very filtrated with heavy drugs and crime and everything that was going on. And at that time, we look at then Commissioner Butler got an opportunity of. Yeah, of the mom. Yeah. Hey.
She just
but
happens
yeah,
to
yeah,
be
just
Dr. Flagler's mom.
yeah.
Okay.
You know,
Okay.
hey, you know.
Go ahead.
But anyway, got with Harris Rosen and helped them to see exactly what you're saying. Why help this community? Let them just kill each other up. Let them just rob from each other. But we're always connected to one another. Everyone is connected. Life is a circle. Everything affects everybody else. So if we help that community to build the pride in itself and to help offer opportunities for everybody's not going to try to do no better. You got some that just ain't okay. We know that. But for those that are going to do better, if given the opportunity, why not? Because what it does is it builds up that community. Okay. And it helps decrease crime. It means that all of the tourists right around there in International are more safer.
Okay.
Now, there's things starting to happen now, but I mean, compared to what was going on then, it's a whole lot different.
Okay.
You know, and you begin to find that it channels down to different generations, because one of the things that you mentioned of how it affects us for years and years to come. That the drug addicted mom and alcoholic dad that has children, those children are going to learn from those parents. No matter how much they see and say, I don't want to be like that, where their other point of reference is. So, you know, it's important because it helps to build our communities and our societies, and it trickles down. Because and it's cost effective. If nothing else, everybody worry about money. It's cost effective.
Exactly. You know, as you mentioned that, and it's something that I had come across some years ago, and this is from the CASA, the Substance Abuse Institute at Columbia University.
Okay.
And they did a study, and they showed that for every $1 that you spent on treatment, that you saved $7, you know, from the community, you know, and that, and when we talk about saving the $7, I also remember that in terms of, and this is just alcohol by itself, that it costs us as a society, and this is just for the U.S., something like, you know, 36 billion with a B, $36 billion a year. Okay, yeah. I'm gonna say this one more
That's
time.
That's a big tab.
36 billion a year in terms of hospital costs, lost wages, damages, you know, through things like DWI, medical treatment, incarceration, etc.
Mm-hmm.
Now, the interesting thing about it, and as you rightly raised, now, if it's going to save money, why put folks in jail? If the real deal is you keep them out of jail and you're going to save money. Now this is where my belief is, where some of the illogic and the racism comes into play. Okay, and that is, there's an old historical fact that I looked up some time ago. I was writing a paper on the implementation of drug laws in the United States.
Okay.
And I found that there is an act called the Halstead Act, okay, that regulated the early cocaine use in the U.S.
Okay.
And I came across, and Charles, this will be, I think, really interesting, in Congress discussing the Halstead Act. Okay, what they did is that they utilized the example of black people being out of control.
What?
Oh yeah. If you go to the
Charles gonna get that one.
No, but I'm
Okay.
just saying. I mean, are you really surprised? Is you know what I was going to say? But yeah,
Exactly.
go ahead.
and they use and this is in the congressional record, okay, and they use the rationale that if cocaine was not made illegal, that that Negroes would become increasingly out of control, and they went there to the raping white ladies scenario. Oh yes, this is in the halls of Congress. Okay?
Wow.
Wow.
And I would say to our audience, check this out. You know, Halstead Act congressional record. Okay, because I don't want y'all to think that we're talking tales out of school here. All right. And what happened is the emotional kick that utilizing that language and that scenario caused. Oh, the other thing that I want to share, they said the other thing about making cocaine illegal and making sure that Negroes didn't get it is that under the influence of cocaine, that Negroes became so super strong that that the ordinary police bullets would not stop them. Okay?
Superman.
Right,
Superman,
right.
Superwoman. Oh,
And
okay.
there was a rationale for increasing the caliber of police bullets based on the fact that they had to be effective enough to stop, you know, out of control Negroes, etc.
Okay. No.
So sometimes when we talk about why some of our laws seem to be, you know, mysterious
Wait,
or
wait.
just baffling.
But okay,
Okay.
I mean, I want you to finish because
Oh, okay.
I got it. I got to make a comment to that.
Okay.
But yeah, go ahead.
That there is at times, aside from money, at times that there is an illogic that appeals to the baser fears, you know, of individuals. But the interesting thing is, and again, even that comes back to money, because when cocaine got to be, you know, made a what do they call it? A schedule. What do they call it? Schedule B.
The
I don't remember
cocaine?
the technical term. A controlled
Yeah,
substance.
Could
Guess-
definitely.
wait a minute.
Yeah.
Guess who started making whole heaps of money? The pharmaceutical companies.
Well, we got the Coca-Cola.
Oh, okay.
Yeah, they was making it with, yeah,
Exactly.
yeah.
So part of the thing, as we think in terms of how these things come into play, part of the thing with incarceration and so many of our black young men being incarcerated is that there was a rationale, you know, in the early '80s of listen, don't think about rehabilitation, lock them up. Okay, lock them up. And in locking them up, that you don't have to worry about your community, that they won't be breaking in, They won't be going crazy. And this is the 80s now. They won't be going crazy and stealing your stuff or raping your wife or, oh yes, folks, I'm going there, you know, or just being out of control. So it was another way of solving, quote unquote, a problem that was created by drugs being introduced into our community. Okay, so when we want to take a look at why some of the laws seem to be at times illogical, we need to consider that. And it means that as a community, we need to raise our voices, and I think have begun to do that increasingly, to say that you're not going to solve any kind of a problem by, quote unquote, a war on drugs. That you are going to solve some problems if you do, firstly, put some rational prevention messages into play that include some of what we were talking about a little earlier, and that is
includes some real intense treatment, the appropriate levels of appropriate treatment too,
right?
And
Even before,
prevention and
right?
treatment.
Even before treatment, prevention,
education,
which needs to be about young people feeling good about themselves, feeling sufficient, feeling cared for, feeling protected, you know, and literally feeling loved, you know, because again, that is not 100%, you know, a cure, or not cure, but 100% preventive. But kids who are grown up in homes that are stable, where there is a sense of protectiveness, there is a sense of them being able to express themselves, and a healthy environment, are much less likely to get into drugs. Again, based on some of what you had mentioned earlier about underage drinking, those that begin drinking much earlier have a likelier possibility of developing both the substance abuse problems and also mental health problems.
Right,
You know,
that's
so,
right. And developmentally, because any of the substances, the alcohol as well as marijuana, all of it, we find is affecting the brain.
Exactly.
And the development of brain, especially in adolescence, you know, the brain is still developing, and what they found is that there's a smaller brain that is now being researched, that they are actually finding a smaller brain in those that have started underage drinking and also using marijuana at an early age, where the brain is still growing and developing. You know, and those are some of the things to get youth to see, because that's where we might have the carrot for them. Because the other things about getting in trouble are, you know, that invincibility.
Right.
But, you know, those are the kind of things now that are being pushed because, you know, that stands out. It stands out because in knowing that there are other choices and having a better sense of connectedness. And then even if you venture, you have a foundation to come back to.
Right.
You know, because some still, even with all of the family and everybody else, we still kind of decide to sow some wild oats and, you know, stuff. But then you do have something to come back to, because a lot of times in treatment I run into adults that never had a foundation. It's not rehabilitation, it's total habilitation. They don't have anything to go back and reunite with. It's building, because there is a cycle. I mean, I've had a mother, father, and son that's the son is in treatment, and the mother and father are both addicts that are either the mother is in treatment at the same time and the dad is locked up. You know, so we know that there are cycles that really need to be broken, you know, but we can do so with joint efforts with everybody, you know, with churches beginning to be receptive and not condemning, but very open to providing the different level of services, the schools, the communities, you know, all of us coming together. If we don't have the money, how can we still come together and do some of these things? The recreation departments used to be all kinds of things. We've got to be able to fill those gaps of time with some productive, positive activities. And during those activities, begin to challenge and channel different information. You know,
Okay.
I loved when I was a part before all this medical stuff and injuries in my old age. But I loved
Okay.
coaching with Girls Got Game because one of the things that we did is that we, aside from praying before practices and games, we also had times that we talked with our youth, and we help to promote positive things, visiting colleges, challenging all of the issues. Midnight
Right.
basketball, we did that with Vince Carter. We
Okay.
always brought up topics because we've got to just flood the youth.
Okay.
We've got to
Right.
flood them
Okay.
because they're getting flooded with everything else.
With the negative information, etc.
Yeah.
As a matter of fact, and this is one of the things that Charles does in working with youth, you know, and that is to provide them with some critical information. Charles, you want to just talk about that?
Well, actually, yes. I was talking about it last week. I wish I had the business card. The lady that was here last week, the organization. Remember that I invited them to come on the show.
Oh, from the sexual.
Yes, actually, they're actually going to do all
Jessica
of.
Mueller.
Right, well, I was trying to who is actually Louis.
Oh, yeah, Louis Delgado.
No. Louis, who used to be the commissioner, he used to be
Oh,
on the
okay.
Mary Johnson, and I can't think of
Okay.
Louis' last name.
Uh-huh.
He's actually but they're actually doing all of my workshops this year,
Ah, okay.
and so we're going into my 12th year. Yeah, 12th year where we have workshops for boys, girls, and parents, and then we come together for one big workshop.
Okay.
So
good,
we've been
good.
doing that now for going on my I think this 11th or 12th year. But I want to ask the question, okay, because it sounds like the people that making these decisions that you were talking about sounded like they started doing drugs at a really early age, and their brain didn't develop, and that now they sound crazy, and so and like we need to get them some help because that's crazy, you know. And these are the people that are running this country, right?
Well, some of them would be.
Oh yeah,
in that
especially
number,
whoever
definitely.
was in that Congress meeting. You just stopped that.
So it sounds
Yeah.
like they started using drugs at a very early age, and their brain didn't quite develop for them to have common sense because that's crazy.
Well, let me put it this way, and I wish I could give them that excuse.
I was trying. I was trying to put it in a nice way.
Yeah,
You know,
I think theirs was motivated somewhere else.
exactly.
Yeah.
You know,
That was nice of you.
and I think they are crazy. But what our community, you know, and I think that we here, and I think we'll come to an agreement on that our community needs to know that it is still being looked at as, I can call easy pickings, you know, for almost anybody to exploit, be it commercially, be it in terms of having substandard products aimed towards us, be it the such things as hair products that we often don't need to use, and as you would say, that's a whole nother show.
Well, but see, we did that show.
Okay.
Remember?
Yeah.
Remember?
Yeah,
The
we
sister-
did.
remember
And
sister-
we
right.
need to do a little bit more.
Right. Yeah. As a matter of fact, I got some feedback from that show. But yeah,
Okay.
yeah. But go ahead.
But the point is that drugs becomes, and I don't want to minimize it, but another way that our community gets exploited. And I think that, you know, Dr. Marcia, I think you're absolutely right that while programs and funding are absolutely needed, but some of the things that you talked about doing, and that is taking the time to spend with the youth, to as you said, flood them with information, to be able to engage them, and to have that connectedness so that they can see that there are folks like you. And as you talk, you know, freely about your recovery history, that yes, yes, you were there, but you are not there anymore. And so you have taken the extraordinary time to give back So many of our community that have been in, if you want to call it, the privilege to have the good luck, of resources,
Graceful, yeah.
have as yet to give back. And I think we need to encourage that, including our churches, to do that. And I see Charles signaling us in terms of time.
No, 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 no. Actually, no,
okay.
no, no. Actually, we got 3 minutes. No,
Okay.
what I was going to say was that when you was asking the question why, when you was asking her why should we, and it's no different than anything else in life, because everything was what should be with the village. Okay, and there's no other, if you understood, there's no other reason but for us to be here for each other, because when we fall, we're supposed to lift each other up, and there's nothing else. There's no, no, that's it. That's the purpose of us being here. It's the village. So there's no question as of why. It's the question of
How?
yeah, how? Yeah, exactly, because that's why we're here, to help lift, and we all fall. We all fall,
That's
every
right.
last one of us. So that's the purpose of us being here, to help each other, because everything, which of course we can go into this, which is another show. What what happened to the village?
Right.
And that's
right.
really what it is. We need the village, and because the fact that we don't have the village like we used to is one of the main reasons why we have a lot of the problems that we have. And a lot of times when you talk to the kids, I sit there and I talk to them. I said, somewhere down the line, somebody didn't tell you that you are somebody. Somebody didn't tell you how precious you are.
Right.
Somebody didn't tell you or hug you or just, help you to understand how you're magnificent. You're
Right.
great.
Yeah.
You're beyond measure. Somebody didn't tell you that.
Right.
And unfortunately, you don't believe it. Because if you did, you wouldn't be doing what you're doing. You don't believe in yourself. You don't love yourself enough.
Right.
And you try to get them to understand that.
Right.
So why should you? Because that's what you're supposed to do.
That's right.
Exactly.
That's right.
I mean, that's what you're supposed to do.
That's right.
Okay.
But
Yeah.
That's
And
all
one of
that's
the
it.
things when you said that even in working with the adults, because if we look at it, particularly our males that are incarcerated today, a lot of them were conduct disorders, and when we say those that end up with having any sociopathic behaviors
Right.
have generally had conduct disorder
Right.
behavior as a child,
And that
in
is
school.
basically being basically
And being-
rebellious in their conduct and being ungovernable.
Right. So now they don't follow rules and they don't like laws, because when they were younger they didn't do as well. But however, what I do though a lot of times in speaking with both the women and the men is I tell them, I say, you're not defined by your circumstances. Your mistakes, the things that you have gone through, does not define who you are. There is yet still a productive and promising person within you. You're just like the gold that gets thrown into the dirt, gets lost, and people cover it up. Then someone finds it, brushes it off. It's still gold. It's still gold. And, and that's one of the things, just like what you were saying, knowing that you deserve better, knowing that you are. You're a wonderful. You're a member of society. You got something to do that if you don't do it, it won't get done.
Right.
Exactly.
You've got to do that. And a lot of times we have to put that imprint, because so much of the opposite has been told. So we have to, again, just flood them with it. Build them up. Yeah, you made a mistake, but you know what? Let's stop. Let's look at what we need to do to help you not make that mistake again. It doesn't mean you're a failure. It's a difference in shame and being guilty of something. You're guilty of something because you take responsibility and you find out what you need to do to not do it again. Exactly. Shame means I don't deserve anything better. I'm going to always do this. I'm no better than this, and there's no help and there's no hope.
Right.
So that's when you said that, it brought me to
Somebody
mind with that.
said this to me a long time ago, and they said life is just a simple bow and arrow. You take and you aim at your target. Sometimes you hit it, sometimes you miss it. And all you do is aim at it again.
No, that's right.
That's what life is.
That's right.
It's just that simple. And then when they said, I said, you're right. It's just that simple.
Yeah.
Sometimes you hit the target and sometimes you miss it. So
That's
you
right.
just aim at it again.
That's right.
And that's what life is.
That's
you
right.
know? Yeah.
Yeah.
And I'm going to take the privilege of having the last word tonight, because
Okay.
as both of you just talked and and have said, there's something that came up that I utilized in one of my counseling sessions this week, and I want to just share it with the audience. And that it's something that a friend of mine gave me as a saying or as a mantra, and that is that today there is nothing that God and I can't handle.
That's right.
Okay?
That's right.
Today there is nothing that God and I can't handle. Audience, we've run out of time. Thank you for sharing with us again. And please come join us next week, because we're going to continue on this journey. And we will be having Dr. Marcia back. I'm not sure next week, but we're going to have her come back again down the road.
Come back before
and we're going to
event.
have to continue this conversation.
Okay.
Good night, and we'll see you next week. Okay.